People are worried about having knee replacements, and it's founded.
A series that gets to the heart of health matters. Narrated by our medical, surgical and clinical specialists.
It's a big operation and there's risks such as wound infections, chronic pain, anaesthetic risks, DVTs, deep vein thrombosis is a risk. But thankfully, they're a low risk. And the benefits outweigh the risks.
One of the myths is that joints only last 5 to 10 years, but the Australian Orthopaedic Association and the National Joint Registry provide tremendous data on the survivorship of joint replacements. A rough rule of thumb is that there's a 1% risk of requiring a reoperation per year for the rest of your life. This means that in 20 years' time, there would be a 20% chance that you might need another operation.
The other thing that historically patients have been scared about with knee replacements is pain. And with the use of extremely experienced musculoskeletal anaesthetists, the hospital stay and the post-operative stay is vastly better than it was 20 years ago.